The youthful shape and firmness of a woman's breasts change over time. Unavoidable factors like aging, gravity, and heredity, as well as pregnancy, breastfeeding, and weight loss can all contribute to sagging breasts. The breasts flatten and elongate, the nipples and areola pointing downward, the youthful shape gone. This presentation is an overview of breast lift. It is not a substitute for a complete consultation with a surgeon. Breast lift, or mastopexy, can restore a youthful, more uplifted shape and firmness by surgically removing excess skin and tightening breast tissue. Areolae, the dark skin surrounding the nipple that may have become enlarged over time due to sagging breasts and stretched skin, can be reduced. The result is a more firm, rounded breast with natural projection and a more youthful position. Breast lift by itself does not increase the size of the breasts. However, it can be done in conjunction with breast augmentation, the surgical placement of implants to increase breast size. Together, these procedures will improve the position, size, and shape of sagging breasts. Adult women of any age whose breast development and weight are stable can be good candidates for breast lift. Pregnancy, breastfeeding, and weight loss cause changes to a woman's breasts that can diminish the effects of breast lift. If you are planning future pregnancy or weight loss, you may wish to postpone this procedure. Good candidates are healthy individuals with no life-threatening illnesses or medical conditions that could impair healing. During a full consultation, you will be asked about your expectations for breast lift. You will also be asked about your health history, including any history of breast cancer in your family and your personal breast health. You should be candid about any medications you are currently taking, the use of any vitamins or herbal supplements, and any alcohol, tobacco, or drug use. Full disclosure is important to your safety. Prior to your procedure, you will be asked to sign informed consent documents. These assure your surgeon that you fully understand the procedure you are about to undergo, including any risks or potential complications. You must also commit to precisely following all instructions you are given. Instructions include pre-surgical considerations such as testing and medications, day of surgery instructions and medications, and specific information relating to the use of anesthesia. Local anesthesia with sedation or general anesthesia is required. A mammogram may be recommended prior to the procedure to check for breast health and to serve as a baseline for future comparisons. Breast lift is generally performed on an outpatient basis. The procedure can be performed in an office-based surgical facility, an ambulatory surgical center, or a hospital setting. Several factors will influence the technique and incision pattern recommended for your breast lift. The size and shape of the breast, the size and shape of the areolae, the amount of sagging in the breasts, the elasticity of the skin, and the amount of excess skin that will be removed. Incision patterns vary, but include some combination or all of the following: an incision around the areola, a vertical incision from the areola to the breast crease, and a horizontal incision near the breast crease. The underlying breast tissue is lifted and reshaped through these incisions. The areola are repositioned to a more natural, youthful height and can be reduced in size by removing skin at the edges. Excess skin is removed and the remaining skin is tightened as the incisions are closed with sutures, skin adhesives, and surgical tape. A small thin tube may be temporarily placed under the skin to drain excess blood that may collect. Immediately following your surgery, dressings or bandages may be applied to your incisions. An elastic bandage or support bra will help minimize swelling and support the breasts as they heal. Before being released, you and an accompanying family member, friend, or caregiver will be given specific instructions detailing your post-surgical care. These include how to care for the breasts after surgery and which medications to apply or take orally to aid healing and help reduce the risk of infection. They will also detail what changes to look for at the surgical site or in overall health and when to follow up with your surgeon. Your recovery from plastic surgery of the breast may include swelling and discomfort at the incision sites as well as in the breast tissue overall. Discomfort is common and may be controlled with medication. You should begin light walking as soon as possible following your surgery, and a support bra may be recommended for a week or two. Initial wound healing may take 1 to 2 weeks, followed by the removal of any necessary sutures. Possible complications include bleeding, poor healing at the incision site, thick, discolored, or raised scars, changes in nipple sensation, and infection. Women who smoke are at increased risk of poor healing. They are advised to stop smoking for several weeks before and after their surgery. In general, breast lift surgery does not interfere with a woman's ability to breastfeed. The results of breast lift surgery are visible immediately. You should be able to return to work or normal activity within a week if you feel ready. However, don't engage in any heavy lifting or vigorous exercise until you are cleared to do so by your surgeon. Intimate contact with the breast and more vigorous exercise should be avoided until healing is more fully completed. This is usually after 4 to 6 weeks of recovery. Healing will continue for several weeks as swelling resolves and breast shape and position settle. Even though the incision lines are placed inconspicuously and will continue to fade over the next year, they will still result in permanent scarring and never disappear completely. Breast lift is a highly satisfying plastic surgery procedure that enhances the shape and position of a woman's breasts. Over time, your breasts will continue to change due to aging, weight fluctuation, hormonal factors, and gravity. However, your new enhanced breast shape and body contour will give you better self-image and the freedom to wear certain clothing styles, including swimsuits. Enjoy your new shape and take care of it by maintaining a stable weight and living healthy, keeping your inside just as rejuvenated as your outside.